We are focusing on difficult venipuncture strategies for your phlebotomy certification exam. The exam will test your ability to handle situations where a patient's veins are not straightforward. Your first action when encountering difficult-to-find veins is to apply a warm pack or towel to the site for 3 to 5 minutes. This promotes vasodilation, making deep or small veins more prominent and easier to palpate. Exam questions will present this as the best initial step. A common trap might involve answer choices that suggest leaving the heat on for too long, which can cause patient injury or hemoconcentration, altering test results. When the standard antecubital fossa is not an option, the exam will assess your knowledge of alternative sites. The dorsal aspect of the hand and wrist veins are acceptable last resorts. However, these veins are often more fragile, roll easily, and are closer to nerves, increasing the risk of complications. An exam question might describe a patient with a visible hand vein and ask for your next step after failing to find a vein in the arm. The correct procedure is to assess the other arm's antecubital area thoroughly before resorting to the hand. One of the most critical rules tested on the phlebotomy exam is the 2-attempt limit. After 2 unsuccessful attempts at venipuncture on a patient, you must not attempt a third time. Instead, you are required to ask another qualified phlebotomist to take over. Exam questions will often present a scenario where you have failed twice and provide several options. The only correct answer is to seek assistance from a colleague. Incorrect distractors will include options like try the other arm or use a different type of needle. While those actions might be appropriate for a first or second attempt, they are incorrect after 2 failures. The use of ankle and foot veins is a major safety and scope of practice topic you must know. These sites should never be used without an explicit physician's order due to the high risk of complications like thrombosis, especially in patients with conditions such as diabetes. A typical exam question will describe a patient with no accessible veins in the arms or hands and ask for the next step. The correct action is to notify the nurse or physician and document the unsuccessful attempts. Never choose an answer that suggests you can independently decide to draw from a lower extremity. Finally, thorough documentation of all unsuccessful attempts is a professional standard that is frequently tested. You must record the sites of the attempts, the patient's response, and who you notified for assistance. To remember these crucial steps during your exam, use the simple mnemonic HEAT. H is for applying heat as your first step. E is for exploring alternative sites like the hand, but only as a last resort. A is for asking a colleague for help after 2 attempts. And T is for talking to the nurse or physician to get an order before ever considering a foot or ankle draw. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.